Okay, so we're going to kind of pick up where we left off last time. So last time when we met, I showed you how to log on to the system, how to look through the patient record, or what we call the patient encounter, how that when you log in, you're on your home page, which is your calendar, and that you can get right to your patient's chart from your calendar. You can do that just by clicking on the patient's name and choosing this option here that says View Patient Encounter. We also went in and
Christy, 1 second. Yes. We're trying to get into the meeting off the invite you sent, and it's not saying meeting not started. I don't know if you've started the video part of it yet.
Okay, I have. Make sure, just in case you have both of them on your calendar, I had a meeting with you guys right before this, so make sure you definitely clicked on the correct one, the one that says clinical training LPN, RN, LPN, NP.
Yeah, that's the one that's on.
Huh.
You can't because you don't have any patients loaded.
I can't get that screen.
You get that screen.
Only once you have on a calendar.
If it's a screen, it won't have any patients.
You can't get into it.
That is correct.
You're in the
Should I
app.
not try to do this now?
No, you should not, and you're in the app, which you don't need to be in that.
Okay.
So if you don't have any patients,
What's the point?
if you don't have any patients assigned to you, what you're going to see is the unscheduled. Oh, come on. So all of yours will be yellow and they'll be unscheduled if you're logging in as someone other than a clinician or someone who has patients on their calendar. Now look at me, I'm stuck. Oh, there we go. Okay. Okay, is that okay if I go ahead?
Not yet. We have still don't. She didn't get.
Oh, you're still trying to get in.
Invite.
Okay.
They didn't have the invite that you sent.
Oh.
I'm forwarding it on.
Okay. So sorry. Just let me know when you're ready.
So I just want to remind everyone who's listening to it's best to be watching the screen and listening. If you have your computers, please close them. It's too difficult to follow along. Christy will click, and if you look down, you won't see what she clicked on. So shutting down your computers, your phones, and just being present and listening. And certainly, if you have a question, we'll pose that. This is being recorded, and you'll be able to go through this again.
You can get on to.
All right, they're on now.
Fabulous. Okay, so we're ready to go? Are we okay to go ahead?
Yes, you can go ahead.
Okay, thank you. Okay, so when we met last time, we also accessed our admission visit from your home calendar, and our practice patient was Tommy Test. And if you remember right, we went in and we looked at the admission note. Now, we got done with our admission documentation, including adding our medications, and we went in and we'd started our frequency orders. So that's where we're going to pick up. So remember when I talked about last time that when you save and close your note, that it allows you to get back into it. So I left it in a saved closed status. So I'm just going to click on my visit again. It's going to open up this box. This is the box that you saw the green plus when you added your note. But because your note's already been added, now you're seeing the edit pencil because we're going to go in and finish documenting. So if I click on the edit pencil, it takes me right into my note. We remember last time that we completed the documentation, and actually we didn't, but I did go in and complete the documentation for us so that we can see how everything flows. You remember that we went to the medications tab and we ordered meds, and I got your med kit to add. And then we went to the Orders and Care Needs tab. And remember, the first thing we did was we went into the care plan with the edit pencil. So when you go to the care plan under edits, if you go to the far right, there's an edit pencil. If you click on that edit pencil, it opens up the care plan. Now, and we're not right now going to worry about anything that's in this care plan. We're just going to scroll down here to where the calendars are. And we did the nursing schedule. So we did the skilled nurse visits for twice a week, and then we added 3 PRN visits. So just so that we can go through the frequency scheduling again, let's go ahead and schedule our aide as well, because you guys as nurses are going to be the ones responsible for scheduling your aide. So to do that, we're going to scroll down here so that we're on the left-hand side, right here where it says discipline. We're going to change that to HHA. And typically, your aide goes on a weekly frequency. Remember, our frequency options are week, month, day, every, and PRN, so you can change it. And this patient was admitted on Monday. So when are we going to send the aide out to begin with? Probably on Tuesday. So let's say this aide's going to see your patient on Tuesdays and Fridays. So unlike the nurse, because we hadn't had the aide scheduled, we can go ahead and select Tuesday and Friday for the remainder of the benefit period. So if we just go to this duration, it's going to tell us how many weeks is left. It says 13. If the Friday and or the Tuesday don't fit in that 13, the system will tell us. It won't let us go past the benefit period. So we're going to click on 13 and click add, and it let us put those all in there. So the blue is the nurse, the reddish is the aide, and of course, as you know, the aide does not get PRN orders. So that's the scheduling for you guys. Then remember when we came over here to the order description, right now the aide is the one that's highlighted. So because one of these is highlighted, this edit order description box is open. So we're going to go ahead and put in our orders for the aide. To do that, we're going to go over here to the right-hand side of this bottom box to this little thing that looks like a Lego, and we're going to click on it. When we do, it brings up all our standing orders. Now we want to filter that type to HHA. So there's your HHA orders. We're going to go ahead and select that. If there was more than one, you could select whichever ones you want and save. That's going to put that information down here under Edit Order Description. Now, we still have to create the aide plan of care. This is just that basic order that we want on the plan of care. So we're going to update. When we click Update, it's going to move these orders up here in this box. And then we did the nurse last time, but I wanted to do it again this time. So I'm going to highlight the nurse. It's going to open my Edit Order Description. I'm going to click on my little Lego, and I'm going to filter my type by skilled nurse. So here's all my skilled nurse ones. So this patient, let's say they're not going to be in continuous care, so we don't need that one. The patient currently doesn't have oxygen. We don't need that one, but we're going to say they can have oxygen PRN for shortness of breath. We want PRN visits for symptom control. You can have O2 sat. Patient doesn't have a calendar. You're going to assess GI, assess needs for other disciplines, however you guys do this. Then you'll just click Save. It's going to bring it back to that Edit Order Description section, which is right here. If you need to edit anything, you can. So maybe you want to change, maybe the order says the patient can have O2 at 2 to 4 liters. You can change anything in here you want. Once you're done, you're just going to click Update. It's going to move it up here. So you got your nurse orders, You got your aid orders. Now you're just going to scroll to the bottom, and there's a link right here that says Schedule Discipline. You want to make sure you click that link.
I want to open my click.
Clicking that link is what's going to put those visits on the calendar. So if you've done your frequency and the office calls you and says, hey, you need to get in and write your frequencies, and you say, I already did, and they say, well, they're not on the calendar, it's because you forgot to hit that Schedule Discipline link. Okay? So we've scheduled our nurse visits. We've added PRN for nurses. We've scheduled our aid visits. Now, the last thing we need to do is create our aid plan of care and create our nurse problems, interventions, and goals. So to create our aid plan of care, I would do it first because the aid cannot document until you have their plan of care done. So again, we're still under the Orders and Care Needs tab in your visit note. If you already completed your visit note, you can still do this Orders and Care Needs under the Orders tab in the patient chart or the patient encounter. So we're going to go to the care plan again. We're going to go clear to the right again, but instead of the edit pencil, we're going to do the drop down. And when I hover over the drop down, all I want you to think about right now is this add care needs. Because I know there's a lot right here, but we're going to focus on the green plus with the add care needs. Remember, a care need is a patient problem. So we're going to add the aid care plan first. And the reason that we're adding an aid care plan is because our patient has problems taking care of their own ADLs. So we're going to do put in the date, put in the discipline. Now remember, you're nurses that are creating this, so it's going to be our tendency to want to select our own discipline. But remember, we're creating this for the aid, so you want to do HHA. When you do, a whole box will open up of different care needs, and your aid one is right here at the top, Hospice Aid Plan of Care. You just click on that. You do not need to do a level. Come down and click Save. When you do, it's going to move that aid care plan down here to this section called Care Needs. So here's your aid care plan. And now we're just going to go add our interventions and goals. So to do that, again, we're going to go clear to the right to the drop down, and we're going to click Add Goals. When I click on Add Goals, your goal options will come up. And what you guys have is hospice patient and or caregiver-centered goal. So you're just going to select that one. You're not going to do anything with goal status, anything with start or end date. Just select that goal and click Save. Then we're going to skip the Edit Goals, and we're going to go right to Add Interventions. When we click on Add Interventions, this brings up all the interventions that you can choose from for your patient. So the first one that you want to choose for every single patient is this one that says number 1, Patient Summary, because you're going to go in and type in your summary of your patient and what your aid needs to know. Then you're just going to go through here and decide, you know, are they a bath or a shower? What all do you want done during their visits? Fall precautions, make bed, oral hygiene. You have another box, and actually I have more other boxes that will come up that I created so that if there's something that you want to put that's not on here, you just select that other box and we're going to edit it. Patients a DNR, we want pericare, no BM in 3 days, report pain, report skin, let's reposition, let's apply lotion, and tidy area. Again, you're just going to select the interventions you want. You do not need to have a start date. Click Save. That was the add interventions. Then you're going to skip the edit interventions because that's for later. Let's say you had a patient that had initially had a shower on their care plan, and now we're changing them to a bed bath. That's when we're going to use that. So we're going to skip it for now. Then we're going to go down to Edit Goal Description. When I click on Edit Goal Description, it brings up my goal. If I click on the goal, it brings it in an edit mode. Then you can type in your patient and or caregiver-centered goal for that particular patient. You're making this individualized. Then you're just going to save. The next thing is the very last thing on the list, which is Edit Intervention Descriptions. You're going to click on Edit Intervention Descriptions, and then you can click on any of these that need to be edited. So for sure, you need to edit your patient summary, because this is where you're going to put your patient information. Or whatever you guys normally put in here. When you're done, you're just going to click Save, and you can go to any of these and edit them. So let's say you chose this other because there was something you wanted your aide to do that's not on here. Whoop. Then you can just take out the other and type whatever you want. To take or whatever it is that you're wanting to do. When you're all done editing what you want, you're going to just click Save. So your aide care plan is done. Those interventions are going to flow to your aide visit note, and they're going to be documenting towards those interventions. So now let's go put in your problems and your interventions. To do that, let me get my chat box up just in case. We're going to go back up here to this care plan, clear to the right, hover over the drop down. Again, select Add Care Need, the date that you're starting your care needs, and the discipline that the care needs are for. And these ones are for you. So we're going to do RN. They will flow to the LPNs as well. Okay, they're going to flow to anybody that's considered a skilled nurse. And then you're just going to go through here and find which ones pertain to this patient. And all of yours say Hospice RN, and then the different things that go along with that. So we're going to say Hospice RN, anxiety, agitation. Let's do a constipation. I do have the change in level of care. Don't forget, when you're going back and forth from levels of care, you do have to care plan that. Let's say we also have dyspnea, incontinence. I'm just choosing some, so they may not even go with this patient's diagnosis. Anyway, there's all the RN ones. You also have one that's called Hospice Start of Care. And these are going to be all those orders or interventions that you guys normally put on every patient, regardless of their diagnosis. So we want to select that one also. And then you're going to save. Again, it's going to move that care need, all those care needs down to the bottom. So now you'll see all the RN care needs. And for every one, you're just going to go to the right, hover over the drop down, add your goals. These are all your goals that Jean gave me to go with your start of care interventions. So you're just going to select whatever ones are appropriate. Again, no reason to do a start date or an end date, and no reason to do a goal status. That's going to come later. Then you're just going to go to your add interventions. These are your start of care interventions for all patients, so I would just check all of them. Then you're just going to go to your next one. So I did the hospice start of care, so let's go to the pain. We're going to add goals. And you can add 1, you can add 2, you can add 3, whatever you want to. And we're going to add interventions. Now, again, you also have the ability to edit your goals and edit your interventions for any of these. So just remember to click on your edit goal description, click on the actual goal, and then you can put in your individualization. Edit intervention descriptions, lets you click on the intervention and add to it or individualize it. Okay, let's go to this one, and I'm just going to throw these in real quick. It's pretty repetitive, but I'm going to put these in because we want to go look at a routine visit so you can see how these flow to the routine visit. And I probably picked way too many because remember, you can't work on everything at one time. So you're going to prioritize your patient problems. And it may seem tedious right now, but you get very fast at putting these in because you'll learn to know what's in there for your goals and interventions. And so you'll be able to scan them real quickly and mark what you want. And one more. Whoops. Okay, so when you're completely done with your goals and interventions and you're still doing this inside your visit note, you're just going to go back to your service note tab. This time, instead of saving and closing, you're going to hit the complete button. When you hit the complete button, it's going to put your electronic signature on here, and you're just going to accept in the lower left corner of that box. When you accept and it completes it, it's going to take you back to your home page, which is your calendar. And when you hover over that little piece of paper to the left of Tommy Test's name, it'll tell you a completed service note exists. Now let's go, before we do the routine visit, I want to go to his chart. So I go into Tommy Test's chart. First, let's go look at the meds. So all the meds we put in during our start of care, and I went in and put some in for us when I was documenting, are right here. So it all flows to here. You also have the ability to here to do anything that you could do on the meds tab in your visit note. So if you forgot to add the medication kit in your visit note, you can add it here. If you forgot to approve your med profile, you can add it here. If we go to the orders tab, if we scroll down a little bit, oh, you guys don't see it, I'm sorry. So for administrators and those people who are dealing with the HIS, they'll have a section right here called Hospice Item Set. And when your note is in a completed status, which it is, we hit that complete button, which put it in an approved status. Let me get rid of this real quick. Then that HIS information is going to flow and create your HIS document. Now let's go and look inside your care plan. To look inside, remember, we're going to click on the edit pencil. And we've got our primary diagnosis. We have the comorbid that I put in, even though you guys are probably not going to be doing that. You're just going to be putting in your primary. For your comorbids, when they're highlighted, you can mark them as a comorbid or secondary, and you can mark whether they're related to terminality or not. Your medications are on your care plan. If you scroll down, all of your locator items, all of this information is filled out because you filled it out in your visit note and it flowed to here. Then it comes down to your course scheduling, and then here are these boxes as well. And these all were created a couple of years ago because of high deficiencies in these specific areas. So I put them right on here and had it flow from your note so that your surveyor, it's right there for them. They don't have to search and say, oh, you didn't document this. They can see it right on your care plan. So that just shows you how all the information flows. Does anybody have a question before we go on to routine visits?
Yes, Christy, it's Julie.
Yes.
Where in that entire admit form does what we're calling now the clinical note exist where we have to do a narrative? We haven't seen that yet.
Where in the admission note or in any note?
Specifically in the admission note for right now.
Okay.
But there's a narrative that is done on every visit anyway, so it's a open question. I mean, it flows to both admit and revisit.
Right. So there'll be a narrative section right before your IDT section. You know, where we showed you those IDT comments? That's where your narrative is going to be, is right before there. Let me go. I need to go. This login cannot, shoot, what am I trying to say? Won't let me make a note incomplete. So let me go on my other screen. And I got to incomplete it so you can see it. Okay, well, let me update here. Let's go make sure it's in there. Okay, there's your narrative, and you can expand it. Is that what you're asking for?
I am, and
Is there a spell check on it?
Or dictionary.
Christy, I had heard that we had the ability to verbally dictate right into that note.
JP, is JP still on here? I've never done that, but I believe that you
Yes,
can.
I am.
Verbally dictate into the note?
We do not support that.
Oh,
your phone or your device will allow you to use the microphone to dictate into there. We can't be held responsible because there's not real, I mean, unless you're using an actual software like DragonSpeak, which actually does more accuracy for medical recording. We can't guarantee you. It depends on your devices. As long as your device has a microphone that you can click the microphone, you can do voice to text in here. But we just can't be responsible for any data that goes in there.
Thank you.
Well,
When you do that.
We'll discuss that again. Remember, you're not going to know everything right out of the gate. And that is one of the things that is to come. For now, you're just going to type in your narrative. Again, as we evolve, things will move forward and we'll do more.
Thank you. Any other questions before we move on?
Yeah, hold on one second.
Is there a cheat sheet we could have?
When you say a cheat sheet, when you say cheat sheet, do you want like a copy of the note?
No, like something that shows us where the edit pencil and da-da-da-da, like the tab.
That's all. It's all going to be available. Actually, no, they are taking care of that. I believe Molly and them are working with, because we have it all. It's in our, it's called Webflow, which is under the help link. And if you want to show them that, Christy, we can show them that. But actually is what I believe Molly and Tree are working on, or somebody is what they're doing is they're going to get print handouts so that you'll have handouts with cheat sheets on that you want to do them, and they'll determine, because we don't have printouts because our documentation is electronic, and we do releases every 2 weeks, so we would constantly be having to change the handouts. So, but what you can do is if you go to, like, did you show them how to, you click on that help link that Christy just did? I don't know if you noticed that while I was speaking, and then you get a pop-up window, and let's go back, Christy.
Okay. Here's the help link.
So you click on the help link. Yeah. Click on that. You're going to select whether you want home health or hospice training. You'll click on that. And this brings you into our online help system, and it's called WebFlow. But what you'll see over there on the right-hand side in that light green banner, see where it says Role Training? Click on that. And then here you can decide if you're an RN, you'll click on RN. And these are all the little cheat sheets that they're going to be printing out, I believe, for you. So that these are all the things you know. This is going to take you how to sign in, how to apply your signature, how to edit a care plan, how to add a service note. So I believe they're going to print some handouts for you that you'll have available. But this is where you can go online and have an online cheat sheet. But it's a lot of clicking, and if you're on a device out in the field, you can't really click on multiple screens if you're in where you can use multiple screens. But you can also, and if you wanted to print your own handouts, if you went here, one of the things that you can do, Christy. Okay.
Sorry, go ahead. I was just going to show them. You can also search up here for anything.
Yes.
So edit care plan, and it'll take you to how to do different. Here, editing the 485 or the care plan, and it's either screenshots or it's a recording.
And when you're here is what I want to show you, and this is available in all the parts of the application, that if you even want to create your own handouts, if you'll just right-click on the screen there, Christy.
Right-click, okay.
Yeah, and
print.
I can't see your screen. Print.
Uh-huh.
Your screen is so small there, though. So is what you can do you see where it says up, I can't read yours, does it say save as a PDF?
Uh-huh.
Is that what that says up there? For your destination, if you click that and hit save, that will give you a PDF document that you can print out of that information, and you can take that and print that out for yourself. Or even just save it on your desktop or on your home screen, so if you want to go refer back to them.
Yeah, I think that this is getting a little off and a little confusing. So if we can dial this back, and yes, we are going to have handouts, so you have a visual on the few things that you guys need to know, so it'll be by your side. And in that thing that was just shown to you in the help and the role training is all things that really everyone should be already looking at and going through. That was part of the instructions. So let's just take a deep breath and let's kind of get ourselves back to, you saw where the narrative is, and let's kind of get back to the plan for today, if we can.
Okay, so what we're going to do then is we're going to go on to a routine visit. So we've admitted our patient, a couple of days has gone by, and we log in and we see that we are going to see Test Tommy today for a routine visit. So we're going to click on the visit just like we did before. We're going to look for that green plus where we're adding the page service note assessment just like we did before. Again, you're going to get this box where you're going to choose regular because you're documenting in the system. You're not uploading a visit. It's telling us we're doing a hospice RN revisit, so we want to find the note type that is similar. So hospice RN routine. And it's going to open our note the same way. Give me one sec here. Because in our last meeting, I realized this and I didn't get it fixed. So let me do that really quickly. Let's see, maybe I can do it here so I can see it. There we go. Let me add that last box to your routine. There we go. Okay. So again, when it opens up, come on. There we go. When it opens up, you're going to be opening up to the same place. So do you remember you had the 4 tabs? So you got your service note tab, your medications tab. So you'll be able to see, if you don't remember, what all meds they were on. And your orders and care needs tab, you'll be able to look at your care plan. It starts out the same with this service note header and supplies, where you're going to put in your time in, and then we're not doing anything else. We're just going to go to this next. Now, this time when we go next, all of your interventions are going to come up. So these are all the problems, the interventions for the problems that you selected. So for your hospice start of care, you selected assess family for anticipatory grieving, ineffective emotional or spiritual coping. Your task action response, you have choices. If that was completed on this visit, it's not applicable to this visit. If it's something that's just noted, just reminding you of something, you can say noted. You can say patient caregiver refused, and then I need to fix that one. The RN notified is for the aides. So let me go in and fix that. You do not need to necessarily document in these comment boxes. You can if you want to. The aides we've instructed to document in those because they don't have an assessment that follows. But because you have an assessment that follows, then a lot of this stuff is going to be documented in the assessment. So did you educate the patient, family, and caregiver on diets and fluids that'll assist them with decreasing constipation? Now, depending on how many problems, interventions, and goals, depending on how many problems you picked, will depend on how many you can get through at a visit. So if this patient has multiple problems that need to be dealt with, you're not going to get everything done on every visit. Yes, you're probably going to assess every visit for anxiety because that's one of the things that we do. You're probably going to assess at least once a week for skin breakdown unless your patient has skin issues. But you may not necessarily provide education on every single thing for every visit. So some of them will be not applicable because this is for this specific visit. When you're done with that screen, you're just going to go click next, and it's going to bring up the goals that were associated with the problems that we chose. Under your goal status, you're going to have met, in process, not met. Now, obviously, a lot of yours are going to be in process. If it's symptom management, like this one, family and or caregiver will verbalize understanding of changes to expect related to death and dying throughout the plan of care. So that one's probably going to be in process for a long time. But some of them, like this one, where they verbalize knowledge of patient care, medications, and treatments, you may be able to meet it, or a mortuary was chosen within the first month, you may be able to meet it. So this is what went on as far as where your goal is right now.
We're unmuted.
I have a question, Christy.
Yes,
this
ma'am.
is Debbie Leonard. So is it possible to complete this assessment with any of those goal statuses incompleted or not touched?
That is a decision. The system can do it either way. We can require that there is something put here for every single one, or we can let it stay to where it is selected. That's up to your leadership team on how they want to do that.
Christy, we had a question here. If we put goal met, does that fall off for the next visit?
No. And I'll show you how it's going to fall off. Just because it's met, because some goals may be met and they're met forever. Some goals may be met today, but not met in 2 weeks, depending on what it is. So you've marked met, and you'll be able to go look at the previous goals to see what was met. Now here, if I select previous goals, there's nothing for me to see because this is my first routine visit. But otherwise, I can go look at it. If it's something you truly want to take off, then we're going to go into the care plan, and we're going to put an end date on it.
Mm-hmm.
And we're going to talk about how we're going to do that here in a minute.
Does it remind you of the home health charting?
Yes.
Is there other questions before I go on? Okay. And then once you hit next, it's going to take you into your routine visit. So the first piece of your routine visit since COVID is a visit type. Is this an in-person visit or is it a telehealth visit? from my understanding, you guys really, as nurses, are doing mainly in-person visits unless the facility is not letting you in. But CMS says you do have to document on your note what kind of visit it is. So that's what that's for. Then you're going to go right into your first screen, your hospice diagnosis, and your diagnosis-related to terminality, as well as these scores will automatically pre-populate from the last note. So they'll be there for you. But let's say you go in and it's got a PPS of 40%, but the patient has had a decline. And so you say, no, that PPS is 30%. You could remove what was there and put in your PPS. The other thing that we're doing, and we just talked about it on our last meeting, so it's not ready, is let's say that you think that they need to change PPS from 40 to 30, but for the life of you, you can't remember exactly the differences in between the two. You can click on the Apply on Demand, and we're going to have a PPS in here for you that you can add. So you'll be able to add the actual PPS scale so that you can look at it. Then we're going to go into vital signs just like normal. And then you'll notice as we go through the routine note that it is a little bit different than your admission note because it's going to be shorter. It's not going to be as comprehensive. Your pain assessment is pretty comprehensive, but it doesn't have your HIS questions. Your pain ad and your FLAC assessment, if you need them, will be in here. If you don't, you're just going to mark no that you didn't need them. We've got any recent infections, neuro, so you'll see it's shorter. There's your neuro. Your cardiorespiratory is together. If your patient is on oxygen and an oxygen safety assessment hasn't been done, you'll be able to apply an oxygen safety assessment on demand. So there's one in here, right here. If one's already been done, then you don't need to. So you'll have this option on admission, but sometimes you don't start oxygen on admission, but you do start it somewhere through the hospice stay. So we wanted this available to you for if you needed it. So that's your cardiorespiratory, your endocrine, your GI, your nutrition, GU, MS, speaking of MS, let me go back. If the patient had a fall, it's going to ask you, was the post-fall visit documentation completed? Meaning if they just had a fall, has anybody completed the new fall risk? If you were the only one that found out about it, then no, it hasn't been completed yet, and you want to go apply it on demand so that you can add it. Because if they have a new fall, you got to do another fall risk. Integumentary assessment, and remember, if they have wounds, all our wounds are apply on demand. The one thing I will tell you is if you do, let's say this patient has 3 wounds. Let's say that you apply a venous ulcer and 2 pressure ulcers. It's putting those sections in your note. Of course, you're going to change your section and go to your wounds. You'll document on your wounds. Then next time, when somebody else does a routine visit, those wounds will automatically be in their note. So they'll already automatically have a pressure ulcer 1, pressure ulcer 2, and venous ulcer 1. That way they don't maybe accidentally name them something different than you named them, and then the surveyor gets you. So they'll automatically be there. And all you have to do is hit this copy previous data if you want their information to flow, and you edit it. Now, if I do it now, there's nothing to flow. because there's no note in there. But they'll already be there for you, so you won't have to do the apply on demand. Then we have the Edmonton, our routine medication evaluation. We talked about the ones that are going to be required based on regulation. Any new psychosocial or spiritual concerns. This is mainly if the chaplain and social worker are not in the home. I probably should add NA to that. And then here is your narrative. Documentation of collaboration. So if there's anything that went on that you changed during this visit, or maybe you changed the frequency, or maybe you had to call the doctor and you increased medication. Don't forget, any change to the plan of care, you have to show collaboration with all the pertinent parties. So attending, if there is an attending, the patient and family, the hospice medical director, and all the IDT. And then here's your IDT comments. And remember, those IDT comments are the ones that are going to flow to your IDT review. Followed by those will be your aid supervision. I'm going to add one thing up here that's not here yet, and it will say, are there aid services at this time? Yes or no. That way, if your patient doesn't have an aid, you can mark no, and then we'll know why this is blank. Same for the LPN supervision. I'll add a note at the top. Our LVN is for your guys' part of the country. Are LPN services being utilized or something like that? Yes, no. And then that's the end of your note. Now let me tell you, let's have a scenario. Let's say that I went in to do my routine visit and I noted that the patient had what seemed to be symptoms of a UTI. So I call the doctor and I say, you know, his urine's real odorous and he's not, you know, his orientation and his confusion is worse, and I think he's got a UTI. So the doctor decides to go ahead and start him on an antibiotic. You can go right to your meds tab and you can add your new antibiotic. So let's add it. Of course, it's going to be new. I'm going to use Bactrim. Remember, you just have to fill this in, one tab, twice a day. It already has your route. You'll put in your date. I think that was the 4th. The type of medication it is, who prescribed it, who's administering it, what pharmacy, and if there was a second doctor on the file, was there another doctor, you know, that you notified? And then who approved it? The approval means that you took the verbal order. Then is this hospice med covered? Yes. And do I want to create an interim order? Yes. And the reason we're saying yes now is because if our care plan is closed, so it's been approved and it's been sent to the doctor to be signed, then this med won't flow to the care plan. So we want to create an order to go to the physician. So we're going to say yes and save and close. Don't forget, anytime you order a new medication, you have to approve the medication profile again. So you've got to check your Bactrim, if I can find it on here, for the alerts, the drug class and allergies, side effects, pharmacological information, and then drug-to-drug interaction. And then you have to say that you checked all that. So we're going to click the approved medication profile again, enter our signature. In this case, there was no new drug-to-drug interactions, so all you did was note it. You didn't have to manage, or you didn't have to notify the doctor.
Can you go over that one more time, please? That when I add a new med and where I go, because I'm doing that when I add multiple medicines, and then I'm adding a new med as a nurse, approve or review the drug-to-drug interaction.
Oh, that piece? Yes. So I'm going to do one other thing, and then I will show that, because we're going to have to do that approved medication profile again. So let's also say while you're there that you notice that because of his possible UTI, that his, let's say he, let me think of something. Let's say that we want to increase his Seroquel. Doc says, go ahead and increase his Seroquel just in case it's not a UTI. So now we're changing a medication that we already have ordered. So we don't have to add a new medication because we already have this one ordered. We just need to change the dosing and have an order for that. So to do that, instead of adding your medication and having to DC that one, you're just going to click on the medication that you're changing. It's going to open it up, and you're going to notice that the medication, the dosage, the patient dosage and frequency, and the route are all grayed down. And it's telling you that's your existing medication. But you want to change this to a tablet and a half. You're just going to click on this change medication / dosing. It's going to open up those boxes other than the medication. It's going to automatically change your entry type to change. You can go in here and make 1.5 tabs. All your information is still filled out. Yes, it's hospice covered. Yes, we need to create an interim order or an order to be sent to doc, and we want to save medication dosing. What that's going to do is, let my computer catch up with me. What that's going to do is it's going to put in your new dosing here with a start date of today, and it's going to put your DC'd medication under your inactive.
Okay.
And there's my DC'd. So let's do the medication profile again. So we're going to check it again. When we click on, sorry, sometimes I click too fast. What you're checking is drug-to-drug interaction, any alerts. So you'll just click on that and it'll open it up in a separate window. Any interactions, drug class, and allergy class. And then over here under the drop down, you can get side effects. Yep. I guess I got to be on active meds. You can get side effects, pharmacological information, your patient education in English, and your patient education in Spanish. And you're going to document that you noted all this. So was there a new drug-to-drug interaction with the Seroquel or with the Bactrim at a level that you're required to notify the doctor? So there's not. All these were already there and he was already notified, but you still have to approve your medication profile. So again, you're going to click on Approve Medication Profile. This comes right from the CMS regs. It's saying that I certify that I have reviewed and documented all current medications per agency policy and have notified the physician of potential adverse effects, significant drug interactions, duplicate ineffective drug therapy, and potential contraindications. So because there was no major or whatever level that you had, you don't have to notify the physician. So you'll have to check your policies and see, does your policy say major or does it say all interactions? Whatever your policy is, you're just going to sign that. This shows that you did it. If you did have to notify the physician, you can document that right here. Any questions about this piece before we move on? Do you know how to add it? Yes, ma'am.
It's going to be after this one. This is Jean. We had a question in our room, but you moved on to the medications. We just want to
I'm sorry.
In that IDT note box, we have to, the discipline has to put who they are, right? Like SN, MSW,
yes,
and then put their note in.
Correct. And in time, I'm hoping that the system will put your discipline in for you, but right now it doesn't. So if you don't put your discipline in, it runs together with the other disciplines. So it's much easier to read if you put your discipline in first and then write your comments.
Medically, from the visit.
It will, but not the discipline. So you right here.
Right.
Okay.
Compiled IDT.
Thank you.
But you have to say you're an SN, chaplain, social, whoever you are when you type in.
Thank you for reminding me of that.
Okay, yeah, it's Jean, we're in another room, so we just had that question. Okay, thanks.
Mm-hmm.
Christy, this is Debbie again. I have a question about the med profile. I see that there is a fax medication tab, and are we going to be able to fax orders to the pharmacy to fill?
The system will allow you to fax it. Now, what your guys' policy is or procedure and how you do that is up to you guys on what you guys do, whether you'll be faxing it or someone else. But the system, yes, will allow you to fax these. When you click on that fax medication, it's going to ask you what you want included, because depending on who you're faxing it to will depend on what all you want on here. You know, like if you were faxing it to a patient, do you want the drug-to-drug interactions? Do you want the inactive meds, the classifications? But if you're faxing it to a pharmacy, then you probably want the pharmacy address, the patient date of birth, and the primary physician information.
One of the other things that if we're faxing to a pharmacy, we're going to need to have a patient ID and also patient allergies.
Let me see if they're on here when we already create it. I think it might already be on here. Let me look at it. Okay, so your allergies are automatically going to print, so you don't get an option on whether to include that or not include that. It automatically includes that. And then did you say the patient, so we got a patient date of birth. Did you say you needed an MR number?
Right. But that looks like it's a medication profile. I'm talking about faxing a medication order to the pharmacy to actually order the medication.
Okay, so for your med orders, yes, they can be faxed. They're not going to be faxed from here. They're going to be faxed from your patient encounter underneath the orders tab.
Okay.
Okay, so we'll get to that.
If that could be something we do at a different meeting, because I know the hospice office team is going to meet again, because the field staff, I don't know right now, are going to do that.
I mean, if this thing's all, I don't know.
Eventually, but remember, we want to do like that bites, like just a bite of what we need to do, and then we can take another bite.
Okay. Any other questions before I go on? Okay, so let's remember that while we're doing this and we're documenting on our note, and we've seen our patient, we've ordered new meds, don't forget what else has to be done from a survey standpoint. You've got to update your care plan. So we've increased the Seroquel and we've added a antibiotic for a UTI. So we need to go add a potential infection to our care plans, to our problems, interventions, and goals. So you're going to come right over here to this orders tab. By the way, here's the 2 medications that we ordered, and we ask the system to create the order for us. So here shows the new order for the Bactrim. There's my order. There's where I already signed it because I put repeated and verified in there. And so then it's ready then for the office to approve and fax to the physician. So there's those 2, but sorry, but we got to update our care plan. So we're going to go to our care plan and we're going to go to the drop down. Oh my gosh, sorry, there's construction in my area, and my internet is slow right now, and I'm wondering if they messed with it, because my internet's normally not this slow. Because we're going to add another care need. What is the deal? And we're going to add it under the nurse. And our care need is going to be an infection. That's going to put that care need down underneath the care needs section. And we're going to go add our interventions and goals to go with it. Okay, so just remember, when anything changes or something happens during your visit, you need to go update your care plan, or you need to add it to your care plan. Another big deficiency out there. So you want to do that. So now we're completely done with our visit. Again, if you are done in your patient's home, but you're not done documenting, remember you're just going to, time out. Go down here to patient signature, select how you're getting your patient's signature. If it's electronic, they'll click on the electronic and sign. And then you can just save and close so you can get back in it later. Hope it's not going to let me, but oh, it did. Okay. And then when we go to that visit, there it is. So it's an open service note exists. So when you try to get back in later to finish documenting, remember the green plus is gone. You're going to use the edit pencil. It's going to take you right back into your note, and you can just finish whatever you didn't get done. When you're completely done, you're going to hit the complete button. That's your routine visit. Okay, let's see. Any questions so far? So let's say that you're in your visit note, your routine visit, and that went on, and you called the doc and you did all that, but you totally forgot to add it to your med profile, to do your med review, and to update your care plan. You can still do it in the patient's chart. So if you didn't do it during your visit, before you completed your documentation, you can still do it here. So when you go to the meds tab, it's the same functionality as it was inside your visit. And when you go to the orders tab, you've got your orders and you've got your care needs, and you can do it here. So you can do it either place. Now let's talk about if I'm the nurse on call. So let's say that I'm the call nurse and I get a call from Tommy Test that his pain is increased and I need to make a visit. I'm going to log into my system, which is going to bring me to my home page, but I need to get to his calendar. So to get to his calendar, I got to go to his chart or his patient encounter. Again, the best way to do that is just find him on my calendar, click on the box, and click View Patient Encounter. When we get to his patient encounter, you're going to go to his calendar, which is under scheduling. If we click on scheduling, it takes us to his calendar. And this is where we're going to get our PRN visit. Now you'll notice there's other places in the system that you can get a PRN visit. I take you guys to this place because you're going to have to be here anyway to assign the visit to yourself. So to me, it's just the easiest place. It's one-stop shop. We're going to go to the patient's calendar. We're going to click Schedule PRN. This tells us that we have 3 skilled nurse PRN visits available. We're going to go ahead and put our PRN visit in, your reason for why, and save and close. When you do, it's going to put that PRN visit on the calendar. And you know it's your PRN because when you click on the little note that's on the right-hand side, it tells you it's a PRN visit. Then you're just going to assign that visit to yourself. So how you do that is just click on the visit, click Edit. Remember, you got to override until everybody's HR file is ready, and then just go find yourself. Where am I? Why am I not in here? I must not have this visit type assigned to me. So if I was in here, I would assign it to myself. So the other thing I want you to see is if you would go to get another PRN visit, it tracks them for you. So now you're down to 2. You used 1. And if you're completely out of PRN visits, you will no longer have this link. So that's your PRN visit. For your PRNs, and I need to, hold on, let me go make sure I have PRN, because I want to show you how they look a little different. So, hold on, I'm working on my other screen. Okay, now let's see if it gets it. Sorry, I had changed myself for the aid visit and it had me in as an aide. Let's see if I'm there now. There I am. Okay, because I want to show you this visit. Okay, so then I've got that done. I'm just going to go back to my home page because that's where I'm going to get to the documentation. Now it's the 19th. I get to Mr. Test's house. I click on the visit just like normal. I look for the green plus just like normal. It's a regular visit. And this was actually supposed to say PRN. And my service note type is going to be hospice on-call unscheduled RN assessment. And when we go into this note, you're still going to start out the same way with your header and supplies. I'll add your tabs that aren't up here, but you'll have your other tabs up here. Then what your note consists of is you'll have your interventions and goals, of course. You'll have vital signs, pain, symptom assessment, and cardiorespiratory. After cardiorespiratory is going to come what's called focus problem. So when you do a PRN visit, you're not going to do a whole head-to-toe assessment necessarily. You're focusing on one thing. Of course, we always assess for pain. We always do vitals, and we always do a cardiorespiratory assessment. But the rest of it's just going to depend why you're there. So you're going to be able to click on this Apply on Demand and select which system that you're there for. So let's say that you're there because they are having UTI symptoms. If it's because they're having pain, like we talked about earlier, you don't really have to add any other system unless you did assess for another system. Okay. Why is that showing? Then it'll go to your hospice narrative. I need to see why skin's showing. Hold on one sec. Okay. Then it'll have your narrative, your coordination, your IDT comments, and that's all of that note. So that's how that's different, because you're just going to pull in the system that you would be documenting on or you would be assessing. Any questions before we move on? Okay, so Molly, let me ask you and Jean your opinion on this. Normally I go into the different order types, but would you rather them kind of get down what they've learned so far before we do the order types so that we are taking baby steps?
Baby steps.
Yes, baby steps. Oh,
Okay.
sorry. This is Jean. Yes, baby steps.
Okay. So essentially
Christy, Molly's not on the call. It's Tree.
I'm sorry, Tree. One of these days I'll get your voice, and I apologize.
I know it says Molly. She logged on and left, and I took her spot.
Okay. I should just know when it says Molly that it's really Tree. So we've been through, you know, basically the chart and how to find different things in the chart, how to do your admission, including your frequencies, your aid care plan, and your problems, interventions, and goals. Anybody have any questions on those pieces?
It's still, I have a question for future trainings. I don't know if this is possible. Is there any way to have those things that are supposed to flow over? Can we see that? What that looks like?
Right.
You mean the items that flow forward, like that flow from
all of
visit
it.
to visit?
Yeah, like the IDT, like all the ones that are blank right now. Is it possible, since we did an admittant training, and then if we do a revisit on the same
We
person?
can. So we meet again if you guys want to. We have a meeting set up that's kind of a just make sure everything's on the right track and we're good to go. Next, the 23rd. By then, I'll have trained all of your disciplines, and then we'll be able to add the IDT so you can see the IDT flow.
Yeah, that would be great.
Unless you want to meet before that for that reason. That is Wednesday, so I guess there's not much time before that. That's this coming Wednesday.
No, because we do the next section, 1 and 2 for the second group of nurses on Monday, Tuesday. So,
right, that's right.
So what's going to be available is that this is all being recorded, but also this group that's doing it now can also not hear in person, but through logged on through Zoom, can watch the same exact training again next Monday, Tuesday, if they want to, and if it's all right with Jean and Julie, that's a conversation. So, yeah, the next one that's set up to talk about questions and go over more detail is on the 24th at 8:30.
When is this setup going to be available so that we could support this? Is there some way?
Was there other questions?
Questions, John?
No, it's more like agency stuff.
Agency questions? Okay.
So setup.
Okay. I think Christy, I think the consensus is people are feeling a little overwhelmed.
Okay.
Because it's so different and Go Live is right around the corner. And so I just think there's just a little apprehension or a lot of apprehension on really understanding it. And so we need to do a good job on our side here at Livingston of, whatever trainings we need to set up in terms of helping staff watch the recordings, go into the help section, see their handouts, and use their tablets so that it's more hands-on. They've only been just watching, and it makes a world of difference when they are watching the tape and then doing it on like a second screen. So
yes, it makes a world of difference. And I'll tell you guys, I was a nurse educator at one point too, and the majority of us, like over 90% of us, are hands-on learners. So if you want me to, I can assign visits to you so that you can get in there. It'll come up on your calendar, and you can get in there and get your hands on it.
So if we could talk about that offline, Christy, because there were, we talked a little bit about that yesterday, and I think there's a few things to decide about that. So, and then we can present that to the staff.
Okay. Well, you guys just let me know what I need to do to help you.
Thank you.
So Christy, do we have 10 minutes? This is Jean. Do we have 10 minutes left or?
Yes, we do.
I don't know if there's other sections in the other room that you guys want to see again. We thought maybe in this room, we would like to see adding care needs and goals.
Okay. And do you have a preference whether?
Yeah, we don't have a preference.
On whether we do it from inside the note or from the patient encounter? The functionality is the same. Does it matter to you?
I would rather do it inside the note because I think that's where they would see more of it.
Okay. So let's see.
Christy, this is Jamie. So the start of care plan or care need that Jean created and sent to you, and you configured it to go into care efficient. You used that today as an example, and then you also brought in pain and other care needs. My understanding is in that start of care need, a lot of those things are already addressed in that. And if that's correct, that might be something worth addressing now. So in front of all of the nurses who are there, not to think you need to do the start of care need and then all those other extra individualized ones. Because my understanding is that start of care need has a large majority of what it is that we do. And I thought we were going to have interventions, like a start of care interventions that matched what that care need was and goals. So it wouldn't be as much adding. Is that correct? Or am I expressing it correctly?
I guess I might be a tad confused. So if you've got pain in your start of care, then do you want it shut off in your care needs because you've already addressed it? Would be the first question.
I think this is something we should discuss offline without everyone.
Okay.
We're just going through the process of putting it in. So maybe instead of going through the care needs process, Christy, can you go over maybe adding a home health aid care plan?
Sure.
Okay, that might be something you guys do every time.
Okay, so if you're in your visit note, you're going to come to the tab that says Orders and Care Needs. The very top section of that is the Orders section. And you're going to find your care plan, which is going to sit at the top. You're going to go to the far right to where you see that drop-down arrow. When you hover over the drop-down arrow, you'll get a whole list of things here. The only thing I want you to focus on right now is the Add Care Needs. So we're going to click on the Add Care Needs. This additional box is going to open and it's going to ask you what day do you want to start these care needs? What day do your interventions start? And then it asks you the discipline. So is this for the aide or is it for the nurse? In this case, we're doing the aide care plan, so it's going to be the discipline of aide. When you put that in, all of the different care needs come up, and there's lots of them. There's hospice ones, there's ones that can be hospice or home health, there's lots of care needs. Your hospice aide plan of care is the very top one. So you're just going to select that care need. You do not need to put a level. When you do that, it's going to put that hospice aide plan of care down here underneath this section where it says care needs. In this case, it happens to be on top. You're going to go to the far right, again to the drop-down arrow. You're going to hover over that drop-down arrow, and the first thing that comes up in the list is Add Goals. So we're going to click on Add Goals, and your hospice patient and or caregiver center goal is going to come up. You're just going to select that. You do not need a goal status, an other, a start date, or an end date. We don't need anything else other than just to select that goal and save it. Then we're going to skip the edit goals and we're going to go to the add interventions. We click on the add interventions, all of the aid tasks are going to come up. These are all the aid tasks that you guys have. The very first one is your patient summary.
Christy?
This is the template.
That's the
So
template.
for the patient summary, just for the clinicians, that's where you're gonna put the things that you want your home health aide to know, like, currently, we're putting it under environmental concerns, where you're putting the non-clinical note. They're not gonna see that. So if you want to put, like, there to call the caregiver Mary at this number, or you know, you want to call and have the patient pre-medicated, or you want to give them a little synopsis of what's going on with the patient, that's where your aide will be able to see all of this. Patient-specific information that you want to give to your CHHA. So when she goes to do that visit, she knows who to call, or, you know, whether they have a dog or not, or, you know, whatever you normally would put under your environmental concerns or your non-clinical note that you would want her to know.
We have to start date all those interventions.
Oh, no, she's going to go over there. Sorry, Christy. I just wanted to explain to them what that patient summary was there for.
And if you want that to be titled something else, we can title it aid notes. We can title whatever you want it.
No, patient summary is fine. You know, that's where they would put the information that they would want each home health aide to know prior to, you know, doing their visit or setting up their visit.
Okay.
So just to clarify, Christy built, so in the current system in McKesson, you choose an aid and then you import and you say care plan. There's probably 500 options. We have created a template right now in McKesson. What you're looking at right now is the same template. It has been created in Care Patient. So just like in McKesson, when you would remove tasks and they go to the left of your screen and everything on your right is what you keep, this is the way you identify what you want. Instead of removing stuff, you check off what you want. So they can't have a bed bath and a shower and a tub bath or whatever the choices are. So this is that same template.
Is that box, is the blank box in the upper left-hand corner right next to intervention description. Is it possible to select all?
Okay, you need,
Yes, that's what it does.
So that's our template. So I guess if I were a nurse doing this, I would select all, and then since all of the interventions are in alphabetical order, you can unclick shade or whatever.
That's how I guess it
We, you two, like females,
Yes.
care plan, and you're like,
no, that makes more sense. Uncheck.
Yeah.
So we need some long hair here. Keeps you
Shaving me.
Okay, and so, yeah, sorry, Christy, you can go on.
That's okay. No, that's okay. Go ahead. And yes, you're right. You can do it that way. You can select them all and then just go uncheck what you don't want. So if that's easier for you, whoever was talking about that, absolutely you can do it that way. Did everybody understand what that person, and I'm sorry, I don't know who was talking, what they were talking about? How you select them all and then just go uncheck what you don't want?
Yes.
Okay, I'm going to go ahead and make this person a shower because I want to show you how to change it from a shower. Okay, so then when you have that done, you're just going to click Save. That was under Add Interventions. You're going to skip Edit Interventions, and you're going to go right to Edit Goal Description, because that's going to let you bring up your goal that we know you need to finish, because we don't have it in here. All we have is hospice patient and or caregiver-centered goal. So you need to write what that patient or caregiver-centered goal is. Then you'll save that, and you'll go to your Edit Intervention Descriptions. And you'll click on your first one, which is your patient summary. And this is where you're going to say whatever it is, notes to your aide. And then when you're all done editing whichever ones you're going to edit, you're just going to save it. More questions about that?
Christy,
Yes. Yes, ma'am. Do we want to stop here since we're at our time limit and I know you guys have patients to see?
yes.
Yeah, I think we lost Jean.
Oh, no, I'm here. We're watching it. We're okay. We're done, Christy. Yeah, that was nice. We just wanted to see it created.
Okay.
Okay, thank you.
You're welcome. Thank you guys.
Okay, thanks, and we'll